If you have IBD, Crohn's, colitis, anything in between, there is a protein your gut is almost certainly low in, and most people have never even heard of it. It's called immunoglobulin G. And today I want to walk you through this, exactly what it does, why IBD patients are depleted in it, and how you can use a concentrated supplement form to actually support gut lining from the inside out. I'm Dr. Melamed, pharmacist, functional medicine practitioner, integrative care practitioner, and root cause gut health coach. This is part 2 of the Supplements for IBD series. Let's get into it. What are immunoglobulins? Immunoglobulins are antibodies your immune system makes them to identify and neutralize threats. Bacteria, viruses, toxins. Now your gut has its own immune layer. It's lined with something called secretory IgA. Think of it as a bouncer at the door. It grabs pathogens in the gut lumen before they get near actual gut wall. But there is a second antibody class that's critical here too, IgG. It's the most abundant antibody in the bloodstream, and it also plays a major role in gut immune surveillance. Here's a problem for IBD patients. Research consistently shows that both IgA and systemic IgG function is compromised in active Crohn's and colitis. The gut immune system, it's already under siege, and one of the things that suffers is this first line of microbiome defense. So what happens when that defense breaks down? The gut becomes more permeable, what people call leaky gut, and bacterial components called liposaccharides or LPS start seeping in through the gut wall into the bloodstream. That's not just the gut problem. LPS in the bloodstream is a major driver of systemic inflammation, fatigue, brain fog, joint pain, skin flares. All that can trace back to gut barrier compromise and LPS translocation. What is SBI Protect? That's where SBI Protect comes in. SBI stands for serum-derived bovine immunoglobulin. It's a concentrated, purified form of IgG extract from bovine serum. I want to be clear about what it's not. This is not a colostrum product. Colostrum contains some IgG, but SBI Protect is a far more concentrated, clinically dosed source. It's also not a probiotic, not an enzyme. It works completely differently, through a different mechanism. The product I most commonly recommend is whether SBI Protect by Orthomolecular product or IGG Shield by Designs for Health. And it's available in my dispensary. I'm not affiliated with any of the brands. Both are available through that link in my dispensary. The prescription version of this is called Enteragam, and it's considered prescription medical food. The mechanism, let's talk about that. How is it actually working? Here's why this is so powerful for IBD specifically. When you take SBI Protect, the IgG it contains travels through your gut. In the gut lumen, the inside of the tube, it binds to bacterial liposaccharides and the toxins and pathogenic bacteria. It essentially tags them, neutralizes them, and prevents them from attaching and crossing the gut wall. Think of major protection, less translocation, less immune activation, less inflammation. This is not immune suppression. which is what most IBD medications do. This is immune support. You're giving the gut the tools to use this defense naturally. And here's the clinical observation that really matters. This mechanism means SBI Protect works even when the gut barrier is already damaged. It's not waiting for the gut to heal before it starts helping. It starts working in the lumen right now with whatever the archived culture is looking like. The research shows this. I always want to show you the evidence, so let's look into what the research is actually saying. 2016 study in Nutrition Journal shows significant symptom improvement, including reduced urgency and better stool consistency in patients with IBS, with diarrhea, and predominance using SBI supplementation. That symptom profile overlaps heavily with colitis. Research on zonulin and LPS binding protein, markers of gut permeability, show measurable improvements with consistent IgG supplementation. There's also a data suggesting SBI creates a more favorable environment for beneficial bacteria, a kind of a prebiotic in its way, adjacent effect, especially if you're taking probiotics. It gives it a little help. The evidence base is still growing. We do need larger IBD-specific RCTs, but the mechanism and the cases, it's solid. And in practice, we see the benefit. Who should use it? In my coaching work, the clients who responded best to SBI Protect tend to have active Crohn's or colitis, especially diarrhea predominant or urgency-driven symptoms, multiple food sensitivities that keep expanding, a classic leaky gut sign, low IgG on comprehensive stool test, a history of gut infections that seem to have triggered or got worsened by their IBD, in poor or inconsistent response to probiotics alone. Ideal clients for that. There are also clients who sometimes notice a response fairly quickly within the first couple of weeks, couple of doses. That's the LPS binding mechanism doing its job. How it's used. A few practical notes. This is educational, not a prescription. For your specific situation, see your provider. So powder form is my preference over capsules. It maximizes the contact time with the gut lining, 5 grams to start on empty stomach or between meals, can go twice daily for more active inflammation. Plan for a 60 to 90-day commitment, gut barrier healing. It's not a 2-week process. It stacks well with L-glutamine for a barrier repair, zinc carnosine, take with food, and be mindful of long-term use. And a spore probiotic or Akkermansia containing probiotic. If you have a bovine protein allergy, not dairy sensitivity, a true bovine allergy, flag this with your practitioner before starting this. That's immunoglobulins, one of the most targeted tools I use in IBD support and one of the most underutilized. If you want a full written deep dive in with all the research, more research and references, it's on my Substack this week. Link would be in the descriptions. My full script dispensary and direct links for the immunoglobulin product is below. Always discuss with your doctor. And If you're taking capsules, that's an option as well. Sometimes you're on vacation, you can take powders, that works too. If this video helped, please like, subscribe, share. I give this great, I believe, great content for gut healing weekly. More content coming soon. If you have questions, comment questions. I read all the comments. And I will see you guys next week. This was Dr. Ina with you at Digestive Reset Melamed Institute, your functional and integrative medicine practitioner, doctor of pharmacy, and gut health coach.